I am pleased to introduce Frank DeVries as our moderator this morning for this session. Frank lives in Oakville and runs a consulting firm that has provided services in the water industry for more than 15 years in Canada, the US, and the Caribbean. Frank has been a patient research and a PFD representative on CDTRP's Theme 5 for a little more than a year. He has a heart transplant in December 2012 and has been involved in a number of transplantation-related research projects over the past 10 years. Good morning, Frank.
Good morning, Mary. Thank you very much for the introduction, and hello to everyone. It is my pleasure to introduce our first speakers of the morning, Dr. Samantha Anthony and Joanna Mitchell, to give us an update on the Mindfulness Retreat intervention for mothers of heart transplant recipients. So Dr. Anthony is a health clinician scientist in the Child Health Evaluative Sciences program of the Research Institute at the Hospital for Sick Children. She has more than 20 years of experience in Sick Kids Transplant and Regenerative Medicine Center as a social worker, and she's also an assistant professor in the Factor in Wintash Faculty of Social Work at the University of Toronto. Dr. Anthony is also an investigator with the Canadian Donation and Transplantation Research Program. And second, we have Joanna Mitchell, who's the mother of 17-year-old Riley, who received a heart transplant at 7 months of age. And soon after Riley's transplant, the Mitchell family became involved as volunteers with the Children Gift of Life Network to encourage others to consider organ donation by sharing Riley's story. Joanna and Riley were presented with a TGLN Board of Directors Champion Award in 2017 for their contribution to raising awareness for organ donation. And Joanna became a patient caregiver partner with the CDTRP more recently, with a focus on projects related to pediatrics and the mental health of not only the transplant patient, but the family as a whole. Over to you, Samantha and Joanna.
Thank you very much for the warm introduction, and thank you very much for the organizers for the invitation to be part of the third CDTRP Patient, Family, and Donor Research Forum. We are thrilled to be here today to be able to share with you an overview of our research study, which included a mindfulness-based retreat for mothers of pediatric heart transplant recipients. So we would like to begin with acknowledgement of the land on which the Hospital for Sick Children resides, which is the traditional land of the Huron-Wendat and Petun First Nations, the Seneca and the Mississaugas of the Credit River. Today, Toronto is home to Indigenous peoples from across Turtle Island. We say this land acknowledgement respectfully to acknowledge the rich Indigenous governances that have existed, that are ongoing, and that will continue into the future. This acknowledgement reminds us that we are accountable to our relationships with diverse nations, and that we are grateful for the opportunity to share this land on which we play, live, learn, and work. I'm passing it over to Joanna.
Good morning. Thanks for having me today. I apologize. I have been under the weather this week, so my voice is a bit rough, but I've got my water here in case it goes on me. So as you see in the picture here, this is my daughter, Riley. She was born in 2005, and we found out when she was 2 months of age that she had a heart condition called dilated cardiomyopathy. At 7 months of age, Riley received a heart transplant. Not only were my husband and I first-time parents, but we were also learning how to care for a child that was going to need lifelong medical care. The first couple of years after Riley's transplant, they were particularly stressful. I didn't sleep a lot and I cried a lot. And when Riley was sleeping, I was always checking on her to make sure she was still breathing. The isolation that I felt was profound. There were other mothers in my community that were stressing about childhood vaccinations, but I was just worried about keeping my child alive. So it was a very different experience. As the mother to a child that received a heart transplant, the caregiving and the worrying and the researching and organization of medications and appointments fell to me more than my husband. And over the years, both with speaking with the research team, in particular with Samantha, and by connecting with other transplant mothers, I soon learned that I was not alone in my experiences. And I could see that those that had developed positive coping skills and developed relationships with other transplant mothers experienced better social and health outcomes, both for themselves and their children. And those that did not would often experience symptoms related to post-traumatic stress disorder. Teaching mothers positive coping skills through this mindfulness-based retreat would not only benefit her as the caregiver, but also the child. And I know this is something as a mother way back 16 years ago that I would have benefited greatly from as well. So aligning the research with the patient and family needs. This research and intervention emerged specifically from patient and family identified needs and priorities. So mothers are often the primary caregiver for heart transplant recipients. Dads are great, but we do take on the load of the work. Mothers experience high levels of social isolation and health outcomes. So there's been previous research on maternal coping and pediatric heart transplantation, which demonstrated that there's clinically significant levels of psychosocial risk for poor mental health outcomes in 40% of the respondents. And this appears to be long-term, as the high levels of risk remain several years post-transplant. And I can tell you, like 16 years later, I still have a lot of stress going on. I worry about my daughter constantly. Another study on parents of heart transplant recipients found that 19% of participants met the DSM-4's diagnostic criteria for PTSD, which is a prevalence rate that is 2.5 times higher than that of the general population. And we know successful maternal coping is linked with positive outcomes, and adverse coping is linked with the development of PTSD. Untreated symptoms of PTSD ripple throughout the family system as they impact parenting capacity, which then impacts child health, well-being, and adjustment. So with these in mind, we designed and offered a mindfulness-based retreat for mothers of pediatric heart transplant recipients as an intervention to help reduce the suffering and improve coping through mindfulness skills building and peer support. So we want to align the research with the patient and family needs. So the intervention was designed to incorporate what we already know to be successful for reducing suffering and improving coping, and when is innovatively restructured to meet the specific needs of the population. So there's 5 key targets of this research that were innovative from what already exists. So number 1, this research targets maternal caregivers as the most common primary caregiver in pediatric healthcare, and thus the population with the most demonstrated need for timely support. The second, the pilot design removes caregivers' number 1 indicated barrier for participation, which is time commitment. So traditional mindfulness is usually facilitated as a group educational skill building session, and it'll take several hours in length and occur over a number of weeks, 6 to 8 weeks, with daily homework components. But our pilot intervention is designed as a retreat, so it has an impact, but it's a short time commitment over a weekend. And the third, it will support the mental health needs of mothers through building competence in mindfulness skill building and coping skills through formal instruction to reduce stress and maternal mental health. This will also reduce socialization by providing an opportunity for mothers to build community through shared experiences and peer support. So these tenets have been incorporated to form a retreat style intervention. So this is the first evidence psychosocial intervention within the Labatt Family Heart Center, specifically targeting the intersection between maternal well-being and child health outcomes. The mindfulness-based retreat is exactly what mothers like myself need. And I wish that this had existed a long time ago. when Riley was young, because I know that I needed that community and I needed those coping skills to get through those early years, especially. Some of the quotes from families that supported this: we all want to bring our children home so they can live their lives as normal as they can under the circumstances. The emotional roller coaster that takes place can be difficult for families to manage. Having this connection to others in the same boat as my family, having someone to talk to agree that what I'm feeling is normal and that they felt that too, would be reassuring. You sort of feel like you're a little bit crazy at first because you worry so much. This research is something that I feel would move mountains, helping other parents not feel the way I did when I felt the most helpless and alone. Having supported parents helps the parents support their kids with a clearer mind and a warmer heart. So the feedback from the parents was all very supportive of this intervention.
Thanks, Joanna. So the overarching objectives of this research program were to determine the effectiveness of the mindfulness-based retreat on maternal quality of life, distress tolerance, coping, as well as perceived social support, and also to determine the implementation effectiveness of the mindfulness-based retreat, including acceptability, adoptability, appropriateness, feasibility, and fidelity. So as Joanna mentioned, this pilot project was a 2-day mindfulness-based retreat. Participants were recruited from the Labatt Family Heart Center. Eligibility included a transplant recipient who was a minimum of 4 months post-transplant. The family needed to reside in Ontario and needed to speak English. The retreat included a schedule of mindfulness exercises, including mindfulness skill teaching. So this was a series that built upon the content of the previous series, with the goal of moving participants from introspective personal practice to interpersonal community building. It also included exercises around deep relaxation, which were self-care tools that guide participants to learn how to check in with and relax their bodies. And the focus of the exercise was on stress management as well as relief. And lastly, circle sharing. So participants practice mindfulness sharing and listening in a safe and supportive environment. Skill integration was a focus of the retreat, and the competencies developed in these exercises was incorporated into other activities such as meal times as well as walking meditation. So turning now to study design, a mixed method design was chosen for this pilot study. Quantitative data was obtained using 5 standardized questionnaires, and these included questionnaires that measured coping. So we used the Coping Health Inventory for parents. We assessed mindful skills, so the 5-facet mindfulness questionnaire was utilized. We assessed quality of life using the Pediatric Quality of Life Family Impact Module, distress tolerance using the Distress Tolerance Scale, and lastly, perceived social support using a multidimensional scale of perceived social support. Again, these questionnaires were completed by participants at 3 time points. So pre-retreat, so within 24 hours of actually attending the retreat. Post-retreat, they completed them on the last day of the retreat, and then 3 months following the retreat. Qualitative data was collected through the facilitation of semi-structured focus groups, which were held on the last day of the retreat. And we're also going to be conducting individual interviews 3 months following the retreat. Each standardized instrument will be scored individually, and group data will be thematically summarized by the calculation of means and standard deviations. And the audio recorded focus groups have been transcribed verbatim for qualitative thematic analysis using a qualitative description approach. I'm going to pass it back to Joanna to give you a bit more details about the retreat and to share some of our preliminary findings.
Thanks, Samantha. So this is just a beautiful picture. This was our scenery. The retreat took place at Hidden Valley Resort in Huntsville in the Muskokas. And anybody that knows me knows I absolutely love the Muskokas. So it's just a perfect place to let the stress melt away and have beautiful views. So there were 16 mothers of pediatric heart transplant patients that participated in our first retreat. So we all arrived at the retreat on Friday afternoon and began in a circle sitting outdoors overlooking the lake. we took the time to get to know one another, a little bit about one another, and learn about the agenda. And the weekend consisted of sharing our stories, learning various types of mindfulness techniques, eating beautifully prepared food, and most importantly, making connections with other mothers of heart transplant recipients. I think that the most important thing that happened that weekend was the friendships that were made. Often when you attend such an event, there's a warm-up period where people need to get to know one another, but for us, there was instant connection. So coming out of the focus group, there was some preliminary themes. The first one was community, sharing stories, and feeling supported. So we just had a few quotes that will kind of tell you how the retreat went. You know, when it's good that you know that you're not alone. We all have freakouts. It can be so overwhelming. And you know, it's good to know it's not just me. Girl, I understand you. I got you. You're not alone. Those feelings of horribleness, you're not alone. And, you know, the interconnection between all of us as people and moms was really remarkable. And I think that was something a lot of people took away. You know, there was some moms who hadn't even met another heart transplant mom, and that connection that they felt over the weekend, just knowing they had somebody else to talk to that understood, and they can take that away from them going forward. And then the next theme was the mindfulness and meditation. There was some moms that had never done this type of mindfulness and meditation. They were, when, you know, I was worried about the silence in the meditation portion, but I actually enjoyed it all. I didn't think it was overwhelming. I think it was enough information, and I'm excited, which sounds strange because I do not meditate, to do some of this stuff on my own private time. And they were looking forward to implementing it in their day-to-day life. I think as heart transplant moms, we have so much going on in our heads that mindfulness can be a challenge. So I know some of the moms thought they were just going to come and do yoga all weekend. So this was a little bit different for them, and it was skills that they could take forward with them. Plus, with the atmosphere, you know, experiencing the sounds of nature was quite relaxing as well. And then the next theme was rest, respite, and care. You know, some of the moms, this might have been one of the first times they've gotten away for the weekend. They were able to actually sleep through the night. Financially, they could actually get away, and there was no financial burden. Many moms have trouble spending the money on themselves, and they would feel super guilty to do it. So the fact that they didn't have to, you know, feel guilty about that weekend away was really nice. And the team did a really good job of making moms feel special. From, you know, getting there was little snacks, cupcakes, and gift bags, and the team were the ones taking the photos. You know, usually moms are always the one taking the photos and never in the photos. So a lot commented that it was nice to just be taking care of themselves for a change. In that last quote, you know, gifted in different, the gifted people in all the different gift languages.
So at the end of the focus groups, we asked all the participants for kind of key takeaways and lasting impressions of the retreat. So this captures some of the words that participants used for that experience: validating, relaxing, eye-opening, life-changing, supportive, enlightening, peaceful, amazing, refreshing. And again, the photos that you're seeing displayed were photos that were taken from the retreat. We were lucky to have some great weather kind of that bookended when we arrived and when we were leaving, with a big storm in the middle. But we did have an opportunity to definitely enjoy the outdoors. So again, circling back to, you know, the focus of this day around patient engagement, all of the research that we conduct within our lab is, you know, based on patient needs, is directly informed by patients and families, Again, looking at CIHR's strategy for patient-oriented research and their guiding principles around patient engagement, we always are very mindful of what those are and really engage patients, not only in a successful way, I think, but in a meaningful way. So again, this research is a perfect example of something that emerged directly from needs identified by patients and families. Also looking at inclusive mechanisms and processes, so shared leadership and decision-making with patients who are co-building with us as researchers, practitioners, and other decision makers. And there's also the opportunity for peer-to-peer recruitment and engagement. Again, respectful communication and collaboration, a safe environment, that's being created by all of us to have mutual respect, that is fostered and is characterized by honest conversations that inform and involve people. Looking at multi-way capacity building, ensuring that the capacities of patients, researchers, and healthcare providers are being developed in order to work effectively together. And again, ongoing support for creating environments that promote honest interactions, cultural competence, training, and education. So within many of our research teams, we've actually been engaging in education and research initiatives with patients and families. So that's been wonderful. Also looking at experiential knowledge, which is valued as evidence. So again, being mobilized and translated within our research team. And lastly, a shared sense of purpose. Oops, sorry. All team members are working together towards the goal of timely improvements to the quality of research driven by patient-oriented outcomes. And again, really focusing on what matters most to patients and families. And mechanisms are always in place for a continuous feedback loop in which the results of patient-oriented research are communicated back to patients. So looking at next steps will include the distribution of the T3 questionnaires, so 3 months following the retreat. Again, the retreat was held in April, so those questionnaires will come out at the end of July. We're also going to be conducting semi-structured interviews with participants to again explore any lasting impacts from the retreat. The goal of this intervention was to equip mothers with positive coping skills that will allow them to cope more effectively themselves and to better support their child and manage their care needs with less stress that again will result in improved patient health outcomes and lower healthcare utilization. And results from this study will inform a template for expansion to other clinical caregiving populations within the Labatt Family Heart Center, as well as other solid organ transplant and chronic illness care programs at CIHR. And again, future iterations of this mindfulness-based retreat could be developed to include other family members, so fathers, siblings, as well as extended caregivers. Wanted to acknowledge not only the participants who attended the retreat, but our research team. So in this slide, we have our facilitators, Sarah Hola-Coholt, who's a health psychologist, Annie J, who's a clinical chaplain, as well as a pastoral counselor and an ordained Buddhist nun. Also, Taylor Robertson, who is a social worker at CIHR, Heather Telfer, and Mira Seifert-Hansen were also part of the team, are part of the team. Unfortunately, they couldn't attend the retreat that weekend. We also have Jai and Isabel, who are members of the Anthony Lab, and myself. So I wanted to thank you, everyone, for listening to our presentation, and we welcome any questions or comments. And thank you, Joanna. It's always a pleasure to present together.
All right, thank you very much, Samantha and Joanna. And so as was mentioned before, please feel free to put your questions on the chat or put your hand up and I'll check for hands. I don't know if I can see everybody's hands. I've got about 4 pages of people here. So otherwise, I do have a question here that in terms of this type of retreat, and I suspect that there are many people watching this, if they've been caregivers, that would think this would be helpful for them too. I mean, it's great to have applied that to a very specific situation, which must be incredibly stressful as a mom and as a parent. You really worry about your kids, of course, anyway, and this just makes that even more difficult. How have you thought about how you can scale this up to a broader population, even caregivers of even adult patients? I think they go through similar types of processes. So I don't know if you can provide some information on that for us, Samantha or Joanna.
Absolutely. So as many people on this call will be aware, it's often very difficult to get funding for these type of psychosocial initiatives. So I do think that, we're hoping that the data from this pilot project will be enough to convince other funders of the value of these type of interventions. I agree. There is immense value in this. There is quite a bit of a cost doing a weekend retreat with all expenses paid. And I know even other family members had said, this was restricted only to Ontario. We'd love the opportunity to do this nationally. We'd love the opportunity. When we were recruiting, there was a lot of dads saying, what about me? Siblings. So definitely immense opportunities to expand this. I will say when we received this grant, we had the opportunity to participate in a Dragon Dens competition, and Joanna was there with us. And the funders of the competition were family members, and they approached us to say, this is exactly the type of research that we'd love to fund. Unfortunately, within this smaller circle, the 3 panel judges were cardiovascular surgeons, and we did not receive the extra funding. But I do think this is the type of research that if there are, family fundraisers that families really would like to support. I know the last day of this retreat, all of the moms said, this was so valuable. We want to do this again. So they've actually, they're working to say, why don't we do like a GoFundMe? Why don't we help with some of the actual covering some of the expenses? And again, as in many interventions, many of the families that we really wanted to be able to kind of target with regards to participation, there's just so many hurdles with regards to being able to participate in this. So we hope in the future be able to address some of those barriers and open this up more widely.
All right, thank you very much. I see one hand up. Is that Sandra?
Yes. Great presentation. So what this does is to me, and as you continue to do more research, is what we were talking about in theme 5 of CDTRP. And, you can say holistic approach, or you can just say multidisciplinary, or whatever word you want to use. But for the patient, it's more like, I would like to see the financial impact on caring for patients and caregivers, providing them, for example, a dose of mental health care, right? A dose of exercise and nutrition, right? But when we're talking about here, right? But that the surgery comes with this kind of treatment, and then ideally it's all covered by OHIP. Because if we could go in and look at the financial impact it would have from someone in like Joanna's position, who ends up maybe missing work, having a breakdown, ends up in the hospital, has an impact on her child's health because mommy's sick. So we can get that kind of data, then we can show it from a different perspective.
Amazing comment. Thank you, Sandra, as always. And definitely many of our research programs now are starting to look at healthcare utilization and cost. So like you mentioned, visits to the Emerge, even calls to mental health providers on the team. I would say, definitely the 2 things that really stood out for the retreat for me, moms on the Saturday saying, I slept for the first time in 5 years last night. So just impact of, we know the value of sleep. But the fact that Joanna mentioned, parents said, mom said, I thought I had a good support network. Now I realize this is what support's all about. And now I have, 15 additional members who I can turn to for mental health support. So definitely, Sandra. And again, this was a pilot study, so it's very small numbers, but I still think impactful. We might not see much change from the quantitative because of the sample size, but the qualitative, I think the themes that have already been generated, and with regards to kind of ongoing knowledge dissemination initiatives similar to this today, we'll be able to highlight the value of this type of research. Thanks, Sandra.
Right,
just a quick last comment. It also shows a need for peer support. It's so evident.
Absolutely.
We have one more question. We're about 3 minutes behind, but maybe Sylvain, if you could go quickly and ask your question.
I'll make it quickly. And I love that project, Samantha and Joanna. I'm asking for the researcher input, and maybe someone else can answer. Where are the fathers? Where are they? Because every time I see a transplant recipient, they basically most of the time, at 99% of time, come with the mother. Where are the fathers? And I'm pinching the ones that should feel guilty of not being here today.
Joanna, do you want to, from your perspective?
You know, I've seen really various roles of dads in the care of the children. Like my husband, he's pretty involved, and you know, I'll send him with Riley to her appointments. But the majority of the dads don't take on as much of the caregiving, and I think it's just sort of a natural thing for the moms to take over. We were talking, my husband and I were actually talking about this after, and we're like, I think the retreat would look different for if you got a bunch of dads together and did this retreat, and how they would connect. Like maybe you're going to go out golfing and, you know, talk to each other while you're golfing. I know from our experience with the Canadian Transplant Games, there has been a lot of connection between dads when we go to the games, and how much they appreciate that with each other. So I think there's potential there. I think it just might look a little bit different for the dads than for the moms.
I would say too, like even we've had a bit more difficulty recruiting dads as patient partners. So we would love to have more dads input. In some of our recent grant applications, we've been able to do that, mostly kind of going through moms. Can you talk to your partner? But I think that very different perspective. We've recently published an article looking at the impact of transplantation and the difference between moms and dads. And definitely there is different levels of concern and worry from moms and dads. So thank you, Sylvain, for your question.
All right, thank you very much, everybody. And thanks again, Samantha and Joanna, for your wonderful presentation.